Aloha Kauai, this is your County of Kauai briefing for Monday, January 24th. We're in sunny Kekaha today with our team handing out free COVID-19 home test kits for Kauai residents. The Kauai District Health Office announced 203 new cases of COVID-19 today, bringing the number of active cases to 863, with 9 hospitalized and 9,180 cumulative cases. Over the past week, we averaged 288 cases a day. We are partnering with the Department of Health to distribute 15,000 free COVID self-test kits, and we want to get them out to the community as quickly as possible. We will be at neighborhood centers around the island all week long. Stop by and grab tests for yourself and your ohana. Please respect our limit of 5 free tests per household so that we can get them to as many families as possible before we run out. They're available first come, first serve, and this morning in Kekaha, we ran out of tests after about an hour. On Tuesday, January 25th, we'll be in Hanalei at 9 a.m. and in Kilauea at 1 p.m. On Wednesday, we'll be in Hanapepe at 9 a.m. and Kalaheo at 1 p.m. On Thursday, we'll be in Anahola at 9 a.m. and Kapa'a at 1 p.m. And the final day will be on Friday, January 28th, when we'll be at the Koloa Neighborhood Center at 9 and the Lihue Neighborhood Center at 1. Details are posted at kauai.gov/COVID test. In addition to these free tests we are handing out to Kauai residents, you can order free tests from the federal government. To get free tests mailed to you, visit covidtests.gov. Home test kits are different from the tests used at clinics, drive-thrus, and the convention hall and vans. To help explain the difference, let's ask Dr. B and turn it over to Kauai District Health Officer Dr. Janet Berriman back in the Emergency Operations Center. Dr. B, what do we need to know about using these home tests?
Thanks, Mayor. These are rapid antigen tests, not PCR tests like we use at the testing centers. With the rapid home tests, you get your results in about 15 minutes, and you can test in the privacy of your own home. If you need a PCR test for travel to some destinations, for example, a home antigen test is not acceptable. It's very important to read through the package instructions and follow them carefully. If you don't, the results are less likely to be accurate. Home tests are useful in many situations, especially if you have symptoms and can't easily get tested elsewhere. They are less sensitive and may be more likely to have a false negative. So if you have symptoms and your home test is negative, you should repeat it a day or two later and remain isolated as long as you are sick.
Thanks, Dr. B. What should you do if you think you may have been exposed to someone with COVID-19?
If you think you've been exposed, take a test 3 to 4 days after your last exposure, and if that's negative, test again on the 5th day after exposure. Even if you haven't been exposed, you can use a test as an extra precaution if you're planning to visit someone who may be more vulnerable or before gathering indoors with others. In these situations, it's best to test 2 or more times, at least 24 hours apart, with the last test being just before your visit.
What should we do if we do test positive?
As always, isolate at home for at least 5 full days after your symptoms started, or after your test if you don't have any symptoms. Let your close contacts and your employer or school know you've tested positive. You're released from isolation on the 6th day if you're feeling better and don't have a fever. But please be extra careful to wear a mask whenever you are around others through the 10th day. If you're concerned about your symptoms, contact your usual healthcare provider. The most effective way to protect yourself from severe illness, hospitalization, and death is being up to date with your vaccinations, getting vaccinated and boosted. Vaccines are recommended for everyone age 5 and older, and boosters are now recommended for everyone 12 years of age and older. If you had Pfizer or Moderna, you're eligible for a booster 5 months after your second vaccine. If you had Johnson & Johnson, you're recommended to get a booster 2 months after your dose. For a full list of locations for kids and adults, visit kauai.gov/vaccine. Wilcox Health and Hawaii Health System's mobile hospital vaccine van is holding a vaccine clinic open to everyone aged 12 and older this Thursday, January 27th at the Kekaha Neighborhood Center from 1 to 5. No appointments are needed. Ho'ololahui will host 2 community vaccine clinics open to ages 5 and older this Saturday, January 29th at the Kanui Kapono Public Charter School and the Kekaha Neighborhood Center. Both locations are open from 9 to 11. No appointments are needed. Minors must be accompanied by a parent or guardian. Back to you, Mayor.
Mahalo to all of you who came to get tested at the convention hall and mobile van as the Omicron surge began to hit our island. For several weeks after the holidays, we were reaching capacity every day. The good news is that the convention hall did not run out of tickets at all last week. We have 500 testing spots available there every weekday, and there is no need to come early anymore. The convention hall is open Monday through Friday from 8 to 3:30 p.m. It's a free PCR test, and you get your results that same day. For a full list of PCR testing sites and our mobile van schedule, visit kauai.gov/COVID test. Mahalo, Kauai.